So when we work with children with sensory processing differences, a lot of children have difficulties with some of their motor planning skills as well, and this can significantly impact their independence in different activities of daily living. So sometimes eating and drinking can be quite challenging for these children from a motor skill point of view, and not just from a sensory sensitivity point of view. A really good piece of equipment to have at home or at school is something called a Doidy cup, and it's specifically slanted cup with two little handles. So when a child's drinking from a Doidy cup, they can tilt it, and because of the slanted design, they can see what's in the cup. So they could see their juice, for example, and they can see the juice coming towards them, and it just helps give them that extra visual information to help them coordinate and prepare their mouths for the fluid and to be able to swallow it without choking on of what's in it or spilling it all over. The cups also come in a rainbow of colours, which is really good for children that might be partially sighted or have some difficulties with their visual perception, and also thinking about from a motivational point of view as well. We have a lot of children that can sometimes get stuck on bottles or sippy cup, and sometimes if the simple choice of being able to choose a colour that they like can be a big enough motivator for them to start drinking from a cup, or at least try to. We do a lot of cutlery assessment in the community as well. So we see a lot of children that have difficulty with cutlery skills and using a knife and fork together. So whilst we from a sensory point of view, like to work from what we call a bottom-up approach, so targeting those sensory difficulties that might be impacting their development of their motor skills, to be able to use a knife and fork together. If it's sensory-based in nature, we also see children that have motor skill difficulties that's not necessarily grounded purely in sensory. We also like to complement that bottom-up approach by using a compensatory approach as well. So there's different types of cutlery, like adaptive cutlery, that we can recommend or that children can try. And one type is weighted cutlery. So what's really nice about this cutlery, first of all, it's a nice thick handle, so it's good for children that have difficulty with their grasp and for controlling their fine motor skills. But the added weight in the handles gives them that little bit of extra proprioception. So if they find it difficult to feel their bodies and understand where their body is in space, the weighted handles of the cutlery give them the proprioception that their brains need to remind them what their hands are doing. Okay, so we have here something called a Z-Vibe kit. They have a website called Arc Z-Vibe, and if you go on there, there's lots of information about oral motor development and skills. They design a great variety of different products, including chewy type toys. There's a lot on the market. There's lots of different providers, and we don't recommend one in particular, but certainly if you go onto search engines, lots of options will come up. What I would say in regards to kind of jewelry or like chewy gems and different types of chewy products that some children need to help concentrate in the classroom or just to reduce chewing at home, because clothing's often one that, children chew on quite a lot, is to be mindful, a little bit like the ear defenders, is that each product is slightly different and they can come in different resistances. There's different textures on there, there's different thicknesses, different colours, and some of them are flavoured as well. So finding the right one for your child can be a little bit of a minefield. If you have occupational therapy, if you speak to your therapist, they might be able to give you some guidance and to narrow it down to find one that will be most successful for your child. But again, just be prepared. You might have to try a few different ones until you find the right one for your child. So there's a really good website called arctherapeutic.com, and if you go on there, you can get a wealth of information around oral motor development, oral motor activities, and different products that are available. I have to say that we don't recommend one particular brand, and there's lots of things out there, but in particular Arc Therapeutic do something called the Z-Vibe kit, and it's a vibratory oral sensory motor tool. Okay, so you have a vibrating tool, and on the end you can put different parts of the Z-Vibe kit on there. Okay. And what's really nice about this is it can help with feeding and tolerating different activities such as toothbrushing. So the tool has different ends that you can put on, and they have different textures and tactile input for your child, and you would encourage your child to explore some of these, probably first with using their hands, and then you would encourage them to start bringing it to their mouth around the lip area, and then hopefully chewing it as well and putting it into their mouth. Sometimes you can put food items around there, things like yogurt, which gives them more of an incentive to explore it orally. But also this is a really good opportunity to help children explore flavours if they're on quite a restricted diet, and you can try different things. What we would say is, obviously, if there's any reason why a child is not eating solids, you consult the medical professional involved and make sure that it's safe to use this piece of equipment. You can also get different shaped like spoon heads as well, which is really nice for weaning and for some of the children that are just transitioning from smooths to solids, or that have particular issues with their motor skill development and tolerating different textures. And the spoon heads, again, are textured, there's different depth to them, and they come in fun animal designs. So again, it's kind of more of an incentive for the child to explore it, but it offers them food in a very graded manner, and it controls how much food is offered to the child at one time and how they can manipulate it with their motor skills.